beneficial active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle: 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional: monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. Of those who do experience some acne recurrence, it's typically mild and easily manageable with topical treatments, a vast improvement from their initial severe acne. Isotretinoin's effectiveness is why it's considered the gold standard for severe acne. The trade-off of potential side effects is justifiable when dealing with acne severe enough to cause permanent scarring or significant psychological distress. However, isotretinoin is teratogenic, meaning it causes severe birth defects if taken during pregnancy. This is the primary reason for its strict regulation and monitoring requirements. Any woman of childbearing age must use 2 reliable contraception methods while on isotretinoin and for 1 month after stopping. monthly pregnancy tests are mandatory. This requirement, while burdensome, has made isotretinoin a reasonably safe option when guidelines are followed. Isotretinoin requires enrollment in the 𝑭𝒂𝒄𝒆 program in the United States. This program mandates monthly office visits, monthly laboratory tests, and strict documentation of contraception use for women. Prescribers must be registered, pharmacies must be registered, and patients must comply with all requirements. While this oversight seems excessive, it exists to prevent the tragic scenario of a teratogenic medication being used during pregnancy. Typical isotretinoin dosing is 0.5 to 1.0 mg/kg daily, with cumulative dosing targets of 120 to 150 mg/kg for optimal outcomes. A person weighing 70 kilograms might receive 35 to 70 milligrams daily. Treatment duration typically lasts 4 to 6 months, depending on dosing and individual response. Higher cumulative doses correlate with lower relapse rates. Common side effects of isotretinoin include severe dryness affecting skin, lips, and mucous membranes. Lip dryness is nearly universal. Most patients require intensive lip balm use throughout treatment. Dry skin often requires frequent application of heavy moisturizers. These side effects, while uncomfortable, are manageable. Using a humidifier, applying moisturizer multiple times daily, using occlusive lip balms, and using artificial tears for dry eyes all help manage these effects. More serious potential side effects include birth defects, hence the strict contraception requirements, elevated liver enzymes, elevated triglycerides, requiring dietary management or medication, depression and mood changes, inflammatory bowel disease, and rare severe reactions. These serious side effects necessitate baseline laboratory testing, monthly laboratory monitoring, and careful symptom assessment. Any concerning symptoms should be reported to your dermatologist immediately. Depression and mood changes are particularly concerning, comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, Hormone Therapy and Transition-Related Acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans-feminine individuals, typically improves acne over time as androgens are suppressed. Many trans-feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans-feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established or trigger acne. The ingredients matter significantly. Lightweight hydrating ingredients like hyaluronic acid, glycerin, and humectants hydrate without being occlusive or pore clogging. Niacinamide hydrates while also having acne-fighting properties. Centella asiatica, SICA, soothes irritation and supports skin barrier function. Ceramides strengthen your skin barrier, which is particularly important when using strong acne treatments. Avoid heavy oils and butters if you have acne-prone skin. Coconut oil, shea butter, and petroleum jelly can clog pores in susceptible individuals. However, some facial oils specifically designed for acne-prone skin can be beneficial. Jojoba oil, squalane oil, and rosehip seed oil are lightweight and non-comedogenic for most people. If you choose to use facial oil, use sparingly, just a few drops mixed into your moisturizer or applied as the last step of your routine. Texture matters when choosing a moisturizer for acne-prone skin. Lightweight gels absorb quickly and won't leave your skin feeling greasy. Hydrating lotions provide more hydration than gels while still being lightweight. Creams are heavier but may be necessary during winter or if your skin is severely dry from acne treatments. Everyone's needs are different. Experiment to find what works for you. Application technique is important. Apply moisturizer to slightly damp skin immediately after cleansing or applying treatments. This allows the moisturizer to lock in hydration from the water on your skin. Use about a quarter-sized amount for your entire face. Warm it between your palms, then gently press it into your skin using your fingertips. Don't rub or massage aggressively, as this can irritate acne lesions. Daytime and nighttime moisturizing might differ. During the day, use a lightweight gel or lotion moisturizer that won't make your skin feel greasy under makeup or throughout the day. Many people use a sunscreen as their daytime moisturizer since sunscreen provides hydration and protection simultaneously. At night, you can use a slightly richer moisturizer if desired, though many people use the same moisturizer day and night. If your skin is very dry from acne treatments, you might use the layering or sandwich method. Apply your treatment, retinoid, benzoyl peroxide, salicylic acid, wait 20 minutes, apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. This significantly reduces irritation and dryness while maintaining treatment efficacy. In winter or dry climates, increase moisturizing frequency or richness. You might apply moisturizer twice daily or use a richer nighttime formula. Some people add a facial oil, just a few drops, over their moisturizer for extra hydration during very dry periods. In summer or humid climates, you might reduce moisturizer richness, using only a lightweight gel. If your skin is extremely oily and acne-prone, you might feel you don't need moisturizer. However, most very oily skin is actually dehydrated. The skin is overproducing oil to compensate for internal dehydration. Using a lightweight hydrating moisturizer often actually reduces oil production by satisfying your skin's hydration needs. Sunscreen functions as both protection and moisturizer. Many quality sunscreens for daily use include hydrating ingredients. Use a sunscreen as your daytime moisturizer, applying it after your morning skincare routine and before makeup. Reapply every 2 hours if you'll be in the sun, or use a sunscreen powder for convenient reapplication over makeup. Hydrating masks once or twice weekly provide intense hydration, supplementing your regular moisturizer. Sheet masks or cream masks with hydrating ingredients like hyaluronic acid, glycerin, or honey can be applied for 10 to 20 minutes, then removed. This boosts hydration without requiring daily changes to your routine. It's possible to over-moisturize. Applying excessive amounts or using too rich formulas can clog pores and worsen acne. Use appropriate amounts, about quarter-sized for your face, and choose formulations suitable for your skin type. If your acne worsens after starting a new moisturizer, discontinue it and try a different product rather than assuming moisturizer itself is the problem. Guide 11. Sun protection and UV damage prevention for acne-prone and treated skin. Sun protection is non-negotiable for anyone with acne or using acne treatments, yet it's frequently neglected. Understanding UV damage, sunscreen types, and proper application is essential for protecting your skin from damage while treating acne. UV radiation from the sun damages skin through multiple mechanisms. UVB rays cause sunburn and skin cancer. UVA rays penetrate deeply, causing aging, wrinkles, and skin cancer. Both types of UV radiation increase inflammation, which worsens acne. Additionally, UV exposure causes post-inflammatory hyperpigmentation, dark marks remaining after acne heals, to darken significantly and persist longer. Without sun protection, acne marks that might fade within 3 to 4 months can persist for a year or longer. Many acne treatments increase photosensitivity, making skin more susceptible to sun damage. Retinoids significantly increase UV sensitivity. Salicylic acid and benzoyl peroxide cause mild photosensitivity. Chemical exfoliants, AHAs, BHAs, increase sun sensitivity. Vitamin C also increases sensitivity in some formulations. Using any of these treatments without sun protection significantly increases sun damage risk and post-inflammatory hyperpigmentation. Sunscreen comes in 2 main types: mineral, physical, and chemical. Mineral sunscreens contain zinc oxide or titanium dioxide, which reflect UV rays. They're generally well tolerated, work immediately upon application, and rarely cause irritation. However, they can leave a white cast on skin and may feel heavy. Chemical sunscreens contain organic compounds that absorb UV rays and convert them to heat. They're typically lightweight and invisible on skin but may cause irritation in sensitive individuals and require application 15 minutes before sun exposure to be effective. For acne-prone skin, sunscreens labeled non-comedogenic or for acne-prone skin are essential. Many facial sunscreens are specifically formulated to be lightweight and non-clogging. Combination sunscreens containing both mineral and chemical ingredients often provide the best balance of effectiveness and wearability for acne-prone skin. SPF, sun protection factor, indicates protection against UVB rays. SPF 15 blocks about 93% of UVB rays, SPF 30 blocks about 97%, and SPF 50 blocks about 98%. For daily use with acne-prone skin, SPF 30 is the minimum recommended. SPF 50 provides slightly better protection if you'll be outside for extended periods. However, SPF rating says nothing about UVA protection. Ensure your sunscreen is broad spectrum, protecting against both UVA and UVB rays. Proper sunscreen application is crucial. Most people don't apply enough. You should use about 1/4 teaspoon, 5 milliliters, for your entire face. Many people use far less, reducing actual protection significantly. Warm the sunscreen between your palms and gently press it into your skin. Apply it as the final step of your morning skincare routine, before makeup if you wear it. Daily sunscreen application is critically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96, Acne and Alcohol Use, Interactions and Effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97, Acne and Smoking, Direct and Indirect Effects on Skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100-guide exploration of acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy. If you're on acne medications like isotretinoin, requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during puberty. Community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience, warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86, Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87, Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88, Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory sensitive individuals. Appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45: Nanotechnology in Acne Treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and Climate Adaptation Strategies for Acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne Success Stories, Effective Patterns, and Realistic Timelines for Clear Skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involved or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs, since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment, Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking. Even when staying indoors, is important when using acne treatments. Window glass blocks most UVB rays but not UVA rays, meaning significant UV damage can occur through windows. If you're at a desk near a window or driving frequently, you're receiving substantial UV exposure even without being outdoors. Sunscreen reapplication is necessary if you're outside for extended periods. Reapply every 2 hours, or immediately after swimming or sweating. For convenient reapplication over makeup, use sunscreen powder, sunscreen mist, or simply reapply your liquid sunscreen gently over makeup. Additional sun protection measures supplement sunscreen. Wear protective clothing, long sleeves, pants, and hats when possible. Sunglasses protect the delicate eye area and surrounding skin. Seek shade during peak UV hours, 10 a.m. to 4 p.m., when UV intensity is highest. Even with perfect sunscreen use, additional protection measures are valuable. Vitamin D production requires some UV exposure, so complete sun avoidance isn't necessary or healthy. However, brief incidental sun exposure during daily activities provides adequate vitamin D, while protecting skin involves consistent sunscreen use and protective measures during extended outdoor activities. Sunscreen ingredients sometimes interact with other skincare products. Benzoyl peroxide can reduce some sunscreen ingredient effectiveness. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azelex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achranosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are three main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, though complete elimination is often impossible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles: never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily home routines yield better results than either approach alone. Professional treatments accelerate improvement and address concerns beyond what home treatments achieve. Frequency of professional facials depends on your skin concerns and treatment type. Most people benefit from monthly treatments initially, then maintenance every 4 to 8 weeks once acne clears. Discuss appropriate frequency with your esthetician or dermatologist based on your skin condition and treatment response. Professional facials can be expensive, but the results often justify the investment for moderate to severe acne or significant scarring. Many dermatology offices offer facials at reasonable costs compared to standalone aesthetic spas. Guide 14, Diet, Nutrition, and Lifestyle Changes for Clear Skin. While skincare products are essential for acne management, what you consume and how you live profoundly affects your skin. Understanding dietary and lifestyle factors allows you to address acne from internal and external angles simultaneously. High glycemic foods spike blood sugar rapidly. When blood sugar spikes, lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. 𝒂𝒄𝒆 involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing 𝒂𝒄𝒆-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64, Acne in Patients with Polycystic Ovary Syndrome, 𝒂𝒄𝒆, Comprehensive Management. 𝒂𝒄𝒆 is a common hormonal disorder strongly associated with acne. Understanding 𝒂𝒄-specific acne management optimizes outcomes for affected individuals. 𝒂𝒄𝒆 involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for 𝒂𝒄𝒆 includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in 𝒂𝒄𝒆 often differs from typical hormonal acne in severity and resistance to standard treatments. Many 𝒂𝒄𝒆 patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for 𝒂𝒄𝒆 acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 mg daily. Lifestyle interventions are particularly important in 𝒂𝒄𝒆. Weight loss even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive 𝒂𝒄𝒆 acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying 𝒂𝒄𝒆 pathophysiology and surface acne manifestations. Many women with 𝒂𝒄𝒆 achieve significant acne improvement through this comprehensive approach, even if acne was previously treatment-resistant. The key is addressing underlying 𝒂𝒄𝒆 rather than only treating surface acne. Guide 65. Acne in patients with psychiatric conditions, medication interactions and mental health considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66. Acne treatment and pregnancy, safe options and contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, mild dryness. Zinc supplements taken orally may reduce acne severity, particularly in people who are zinc deficient. Zinc plays roles in immune function, wound healing, and anti-inflammatory processes. Studies show mixed results, but some demonstrate zinc supplementation improves acne, particularly in conjunction with other treatments. Typical zinc supplementation for acne is 25 to 50 mg daily. However, excessive zinc supplementation can cause nausea and copper deficiency, so don't exceed recommended doses without medical guidance. Consult your doctor before starting zinc supplements, particularly if you take other medications. Niacinamide, vitamin B3, is a natural compound with antibacterial, anti-inflammatory, and sebum-regulating properties. While available in supplements, topical niacinamide is more relevant for acne. Many skin care products now include 4 to 5% niacinamide. Studies demonstrate that niacinamide reduces sebum production and acne lesions with minimal irritation. It's suitable even for very sensitive skin and works well alongside other treatments. Azelaic acid, a naturally occurring compound found in grains like barley and rye, has proven antibacterial and anti-inflammatory properties. It's more commonly available as a prescription medication, Azalex, Phenacea, or in over-the-counter products, but azelaic acid is naturally derived. It's particularly effective for post-inflammatory hyperpigmentation and rosacea-related acne. Dietary changes based on research can improve acne. Eating antioxidant-rich foods like berries, dark chocolate, and colorful vegetables reduces inflammation throughout your body, including your skin. Omega-3 fatty acids from fish, walnuts, and ground flax seeds have anti-inflammatory effects and may reduce acne. Increasing fiber intake through whole grains and vegetables improves digestion and may improve skin. Reducing sugar and refined carbohydrates reduces blood sugar spikes that worsen acne. Hydration deserves special mention. Drinking adequate water, about 8 to 10 glasses daily, maintains skin hydration from within, supports detoxification, and promotes overall skin health. While water alone won't cure acne, adequate hydration is fundamental to clear skin. Sleep is profoundly important. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves skin health and acne. Stress reduction through meditation, yoga, deep breathing, or regular exercise reduces cortisol and inflammation, directly improving acne. Chronic stress is a well-documented acne trigger. Even 10 to 15 minutes of daily meditation or yoga can measurably improve skin. Important limitations of natural remedies. Most natural remedies are suitable for mild acne only. If you have moderate to severe acne, particularly cystic acne, natural remedies are insufficient and you require professional treatment. Natural remedies work best alongside professional treatments, not as replacements. Natural doesn't automatically mean safe or effective. Many natural substances are irritating or ineffective for acne. Finally, natural remedies require consistent use for 4 to 8 weeks to demonstrate effectiveness. Don't expect immediate results. Guide 9. Spot Treatment Mastery, Targeted Acne Lesion Treatment and Prevention. Spot treatments allow you to apply potent acne-fighting ingredients directly to individual pimples, minimizing exposure to surrounding healthy skin. Mastering spot treatment techniques accelerates healing and prevents scars. Understanding when and how to use different spot treatments is essential for optimal results. Timing is everything with spot treatments. The most effective time to treat a pimple is at the earliest sign of its formation. Many people feel a small bump developing under their skin 1 to 2 days before it becomes visible. Applying spot treatment immediately when you feel this early bump can prevent it from fully developing. If you notice a pimple just starting to form, small, red, not yet inflamed, beginning treatment immediately can prevent significant inflammation and reduce healing time by days. Different pimple types require different treatments. For small whiteheads or pimples with visible centers, spot treatments with salicylic acid effectively flatten the pimple and accelerate healing. Apply a salicylic acid spot treatment directly to the whitehead using a clean cotton swab or applicator. For closed comedones or small flesh-colored bumps, salicylic acid is also most effective. For inflammatory red pimples without visible centers, benzoyl peroxide is more effective than salicylic acid. For large, painful, deep cystic acne, neither topical spot treatment alone is sufficient. These require professional dermatologist intervention. Intralesional steroid injections are highly effective for cystic acne. Preparation is important. Before applying any spot treatment, cleanse the area thoroughly to remove makeup, dirt, and oil. Pat the area dry completely. Applying spot treatments to damp skin reduces effectiveness and increases irritation. Wait a full 2 to 3 minutes after cleansing to ensure complete dryness. When applying spot treatment, use a clean applicator. Never apply with your finger as this spreads bacteria. Cotton swabs, disposable applicators, or sterile tools are appropriate. Apply a small amount directly to the pimple, covering just the lesion itself and a tiny bit of surrounding skin. Using too much spot treatment wastes product and irritates surrounding healthy skin. Spot treatment frequency depends on the product and your skin's tolerance. Salicylic acid spot treatments can typically be used twice daily, morning and evening, if your skin tolerates it. Benzoyl peroxide spot treatments should typically be used once daily initially, preferably at night, then increase to twice daily if your skin adapts well. Some very potent spot treatments are meant to be used only once or twice weekly. The less is more principle applies to spot treatments. Using more frequent applications or larger amounts doesn't accelerate healing, it only increases irritation and dryness. Consistent, moderate use is more effective than aggressive over-application. Never pick, squeeze, or extract pimples yourself unless absolutely necessary. Squeezing ruptures the follicle wall, pushing bacteria, sebum, and dead skin cells deeper into the skin. This spreads the pimple, increases inflammation, and significantly increases scarring risk. Additionally, using your fingers spreads bacteria to other areas of your face, causing more pimples. If a pimple has a visible white center and you feel you must extract it, use a professional extraction tool or, ideally, have a dermatologist perform professional extraction. If you do extract a pimple, do so properly. First, apply a warm compress for 10 minutes to soften the plug and open the pore. Use a sterile lancet or extraction tool, available at pharmacies or dermatology offices, to make a tiny puncture or use an extraction loop to gently apply pressure around the pimple. Never use fingernails. After extracting, immediately apply an antiseptic and then an acne treatment. This approach minimizes the damage compared to aggressive squeezing. Acne patches are an excellent spot treatment innovation. These hydrocolloid bandages, infused with acne-fighting ingredients like salicylic acid, are applied over pimples. They absorb pus and oil from the pimple while protecting it from external bacteria and irritation. Acne patches work best on surface pimples with visible centers rather than deep cystic acne. They're typically left on for 6 to 8 hours or overnight, providing results within 6 to 8 hours to overnight for responsive pimples. Many people use acne patches under makeup during the day or overnight. They're convenient, visible results-oriented, and non-irritating. Pimple patches containing active ingredients like salicylic acid, benzoyl peroxide, or tea tree oil are superior to regular hydrocolloid bandages. However, regular hydrocolloid bandages provide some benefit through moisture management and protection even without active ingredients. Spot treatment serums and gels remain on your skin, typically used twice daily. Apply after cleansing and before moisturizer. Common spot treatment actives include benzoyl peroxide, salicylic acid, azelaic acid, and sulfur. Choose based on your pimple type. Inflammatory acne responds better to benzoyl peroxide, comedonal acne to salicylic acid. For very aggressive spot treatment, some dermatologists recommend combining low concentrations of different actives, perhaps a small amount of salicylic acid followed by a small amount of benzoyl peroxide on the same pimple. However, this should only be done if your skin tolerates it well and should be used sparingly. For most people, one spot treatment at a time is appropriate. Sulfur spot treatments are often overlooked but can be highly effective, particularly for inflammatory acne and sensitive skin. Sulfur has been used in dermatology for over a century and has proven antibacterial and anti-inflammatory properties. Some people find sulfur more tolerable than benzoyl peroxide or salicylic acid. Intralesional steroid injections administered by dermatologists are the gold standard for large, painful cystic acne. A small amount of steroid is injected directly into the cyst, causing it to deflate and heal within days. This prevents the cyst from persisting for weeks or months and significantly reduces scarring risk. If you have large cystic acne, ask your dermatologist about this option. Common mistakes with spot treatments include starting with too strong products, using them too frequently, using too much product, expecting overnight complete resolution, or abandoning consistency after just a few days. Spot treatment works best with realistic expectations. A moderate pimple treated consistently for 3 to 5 days should flatten and improve noticeably. Large cystic pimples take longer and may require professional intervention. Guide 10. Strategic moisturizing for acne-prone skin, hydration without triggering breakouts. One of the most common and damaging myths about acne is that people with acne shouldn't use moisturizer. This myth causes countless people to have dry, irritated, sensitive skin that's actually more prone to acne. Proper moisturizing is absolutely essential for acne-prone skin, and understanding how to moisturize without clogging pores is critical. The reality is that acne-prone skin, especially if you're using acne treatments, desperately needs moisturizer. Here's why. When your skin is dehydrated, it compensates by producing more sebum. This excess sebum actually worsens acne. Additionally, most acne treatments, salicylic acid, benzoyl peroxide, retinoids, cause dryness and irritation. Using moisturizer counteracts these side effects, allowing you to continue treatments without excessive discomfort. Finally, properly hydrated skin has a stronger barrier function, which improves overall skin health and actually reduces acne. The key to moisturizing acne-prone skin is selecting appropriate products. Look for moisturizers specifically formulated as non-comedogenic, meaning they don't clog pores, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, antiandrogen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare complications include elevated potassium levels that can affect heart rhythm. Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mild dietary changes, hormonal changes. Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves. New evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants. Consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long-term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent,